I think the finance minister, in the given constraints of the total fiscal deficit and the fact that there is very sort of limited elbow room he has to maneuver, he did a very good job. For one, he touched many segments of the population with their special needs and things like that. He touched education, healthcare, whatever. But speaking about healthcare, which is our sector, I think that the initiatives that he announced are quite encouraging. The fact that he said that there will be free diagnostics for people who otherwise cannot afford it, people who will get free medicine who otherwise can't afford it, by itself gives a big boost to preventive medicine and early detection and treatment, so that many people will not need to go to hospitals because they will get their treatment early, they will know what they need, and if they need to go to the hospital, only then they will reach the hospitals which are already crowded. So from that point of view, if you look at it downstream, it has a very positive effect. Then of course we know that there is a shortage of good quality hospitals. By announcing 4 new aims and also committing that every state will have an aims in the next 5 years is a very good move, in the sense that many people who are out of the healthcare net today will be able to access it closer to home, because today travel costs and traveling several hundred kilometers to get healthcare is tragic. The third thing is that the medical schools, very important. Shortage of doctors, this will help to mitigate that. Research laboratories in rural areas to study their special needs, especially in the PPP mode, very positive. So I think overall, the best thing that I heard was that the government seems to be committed to enhancing the public-private partnership opportunity, which the previous governments have actually missed. There is a huge resource of medicine, of human capital, technology, which is available in the private sector, which is waiting to be utilized in a voluntary fashion or a public-private partnership model. Like if you talk about what is happening, the health minister said that the maternal mortality in India is still very high because they do not have the attendant anesthesiologists and doctors to do the cesarean sections or to conduct the deliveries in a safe manner. So our response was very easy. We have huge number of doctors that are employed in the private sector. We as organizations, we as institutions like Medanta, we can actually volunteer these doctors to go to the hospitals on a regular basis and conduct. So collectively, we have got all the private stakeholders together to say how we are able to assist the government. Now, of course, if the government, which is intention is very open, if we can actually implement it, there will be a huge benefit to the last person standing on the ground in India.